tasty refreshments, HHRI swag, pens, and notebooks aplenty. The air buzzing with excitement, and a room filled with people eager to learn about the latest medical research discoveries. This was the scene at the Hennepin Healthcare Research Institute Research Symposium of March 6th. It was an enriching and captivating experience for all who attended. The symposium kicked off with a warm welcome from HHRI President Dr. Kirsten Johansson, who set the tone for the day's discussions with a State of the Institute address.
Good morning. I am so excited to see so many people here. We had about $55 million in revenue from contracts and grants in 2023. We've had a steady stream of projects coming in and continuing. Lots of government-funded, NIH-funded research and other entities. That we had 2 new primary R01s to HHRI come in last year.
HHS Chief Research and Medical Education Officer Dr. Megan Walsh also delivered an inspiring message on the significance of research in healthcare.
Back in the late 90s, I lived in Eastern Africa and Western Kenya for a short period, and I was given a name, and the name I was given was Kwamboka. And Kwamboka in Swahili means the bridge. And that is exactly the role I have been asked to play with HHRI and HHS, is how do we build 1,000 connections that can bring our organization tighter and closer between HHS and HHRI and also with our community. And that has been the goal.
The room was filled with energy, and as attendees eagerly awaited the presentations by a group of select researchers. The goal of the HHRI Research Symposium is to bring the community together, listen to researchers share their aim towards better equity of care through better equity in research, and network.
I would advise anyone to attend them, partially because so much work happens at HHRI, but we have so many different groups doing so much different work, which is great, but that means it's very easy to lose sight of what everyone is doing, and this is a fantastic way to connect and learn that.
Well, I went to the symposium last year, and it was my first symposium, and it kind of just blew my mind how many things we just did not know about that were going on at HHRI, because we know a lot about our specific lab, but it's just harder to talk to the general organization as a whole.
Doctors Sandra Japuntich, Warren McKinney, and Allison Hart were among the researchers who shared their expertise and latest field discoveries. They explained the possible impacts of their work, and the audience was captivated by their findings. Dr. Chapuntich's presentation was on innovative interventions to increase access to smoking cessation treatment.
Higher tobacco use among Black or African Americans, American Indian or Alaska Natives. Effective smoking cessation treatments exist. That's the good news. So there are 7 FDA-approved smoking cessation medications, Undeclin. We have enrolled over 326 patients.
Dr. McKinney presented on building community partnerships to advance equity in transportation and touched on a few projects that he and Dr. Gilm Oyahala are currently working on.
The spectrum of community engaged. There's always a value in reaching out to the community, but it's not reasonable for everyone to just expect that you can do community-driven and community-led research on your first go.
Dr. Hart presented on research efforts to improve access to kidney transplantation at Hennepin Healthcare.
So I'm going to continue with the theme that Dr. McKinney already started to talk about, some of our efforts to improve access to kidney transplant at Hennepin. I'm going to focus on one project that I'm doing in particular, but disparities in access to transplant has historically, what I would say, and actually Dr. McKinney and I wrote an editorial about this recently, confounded social determinants of health with race.
The Q&A panel discussion that followed the presentations was equally exciting, with attendees getting the chance to delve deeper into research topics. The symposium's hybrid format offered both in-person and Zoom options, making it accessible and convenient for all attendees. There was a poster session where attendees could view and discuss the research posters with the presenters.
I'm actually really enjoying the poster session probably the most, to be able to see 20 different posters, and there's just so much energy and so many people really invested and interested in what everybody's doing. I just really see kind of what the panel was saying about this budding collaboration amongst more researchers here.
The poster I have there today is looking at a novel technique, a 3D imaging technique, and a software known as Vesilucida that we have used to characterize the cutaneous vasculature during wound healing in head and neck cancer patients.
It was a great opportunity to network and make a difference in the field of medical research.
The symposium was just like a perfect place to get to know folks, see that you're not really like alone in your journey in research and academia, and be able to make friends and network and maybe work on more projects.
The HHRI Research Symposium was an informative and engaging event that left the attendings feeling motivated and inspired. It was a great success. We can't wait to see what the future holds for medical research. Jimbara Qualah, HHRI.